Good evening, doctors. Welcome again. Today we are going to discuss about gastroenterology MCQs for MRCP exam. Part 1. This is B. A 32-year-old woman presented to her GP complaining of bloody diarrhea. Remember bloody diarrhea. Subsequent evaluation of consultant gastroenterologist lead to investigation including colonoscopy reported erythema and mild continuous ulceration confined to the rectum. Associated biopsies confirmed hematological features keeping with ulcerative colitis. Of the following, which is the most appropriate treatment? Select the single most appropriate answer. Here the best treatment is rectal mesalazine suppository. Rectal mesalazine suppository. Okay. Which of the following is most frequently confined hereditary hemochromatosis? That is C282Y by C282Y homozygote. Okay. Now, which of the following statement regarding hereditary hemochromatosis is true? So the true answer is symmetrical polyarthropathy is recognized feature. Okay. So let's discuss answers. Granulomata are the key distinguishing histopathological hallmark of Crohn's disease. We already discussed in first part. Rectal mesalazine suppository. European Crohn's and Colitis Organization Guidelines 2008 make it clear that the treatment of choice, mild to moderate active proctitis, is rectal mesalazine in suppository form. This formulation is better tolerated than enemas. The combination of oral rectal preparation is effective, but suppository alone are better than oral 5-ASA alone. Okay. C28Y homozygotic count is 80 to 90% clinical diagnosis of hereditary hemochromatosis. Symmetrical polyarthropathy is a recognized feature. Population screening is not recommended for this condition. Venesection can control symptoms and prevent complications but is not curative. The condition is autosomal recessive. Okay. Now, which of the following statements regarding Wilson disease is true? Select the single most appropriate response. So the best one is lifelong therapy with chelating agents such as penicillamine is required. Okay. Now, a 41-year-old man with a history of excess alcohol, admitted by emergency department. He is uncapped, tremulous. With physical examination reveals him underweight with scattered spider navy. No organomegaly is detected. His laboratory investigation are as ALT 123, alkaline is 164, bilirubin 96, hemoglobin 12, WCC is 16, higher side. Urea is 5.6, PT is 2.1. What is the most appropriate diagnosis from the list below? Select the single most appropriate answer here. So this is a case of decompensated this is a case of alcoholic hepatitis. Okay, we are going to discuss later why this. Okay, regarding ulcerative colitis, which of the following statement is accurate? Select the single most appropriate response. Ulcerative colitis is typically characterized by diffuse mucosal inflammation limited to the colon. Yes, this is right. Okay. Lifelong therapy with a chelating agent such as penicillamine is required. Excessive deposition of copper occurs Copper occurs in the liver and brain, although Kasher-Fraser ring are useful diagnostic sign. They are no longer considered diagnostic of Wilson disease in isolation. The sign must be accompanied by neurological manifestation. Although children usually present with liver disease, young adults most commonly present due to neuropsychiatric features. The condition is autosomal recessive. Okay. Alcoholic hepatitis, the raised transaminase bilirubin and clinical settings are most consistent with the diagnosis of alcoholic hepatitis. In fact, the combination of raised WCC, urea, and dearranged clotting tender this severe enough corticosteroid therapy to be considered. There is no radiological evidence to support portal vein thrombosis and no hallucinations or sensory disturbance for delirium. Okay. Ulcerative colitis is typically characterized by diffuse mucosal inflammation limited to colon. Ulcerative colitis is typified by bloody diarrhea and associated with increased risk of colonic carcinoma. In contrast to Crohn's disease, it is not typically associated with abdominal pain and weight loss, and it is not transmural condition. Therefore, fistula is not a feature. Okay. Now, a 39-year-old man with a history of alcohol abuse is admitted with abdominal distension, jaundice, and malaise. Admitting team initiate treatment with Pabrinex, lactulose, and withdrawal regimen of chlordiazepoxide. His renal function and serum electrolytes are within the normal range. Which of the following represents appropriate first-line management of this patient's ascites? Select the single most appropriate response. Initiate diuretic therapy with spironolactone 100 grams per day. Okay. Now, a 62-year-old woman present with gastroenterology clinic complaining of chronic watery diarrhea, which was persisted for the past 18 months. She has a history of osteoarthritis for which she takes regular ibuprofen. On examination, her BMI is 23. General physical examination is unremarkable. Flexible sigmoidoscopy is microscopically normal. Investigation: hemoglobin 12.4, WCC 5.9, platelet 203, sodium 138, potassium 3.9. Creatinine is 109. Stool microscopy is negative for blood but positive for white cells. Which of the following is most likely diagnosis? So this is a case of microscopic colitis. Microscopic colitis. Okay. Regarding the dietary management, proven celiac disease, select the single most appropriate response from the following 5. Gluten should be strictly avoided for life. Gluten should be strictly avoided for life. Okay. So guys, let's discuss this answer. Spironolactone, an aldosterone antagonist, is the first line therapy in ascites due to cirrhosis. Dose 100 mg per day, not gram, but 100 mg per day. Increase according to response. Furosemide, a loop diuretic, can be added as an adjuvant if spironolactone alone is ineffective. Intravenous colloid treatment is usually only needed when renal impairment occurs, and settings of ascites due to cirrhosis fluid restriction is no longer recommended. Microscopic appearance of this woman flexible sigmoidoscopy makes ulcerative colitis extremely unlikely. Equally, the normal blood makes both celiac and Crohn's disease unlikely. The patient used NSAIDs, stool leukocytes, diagnosis of microscopic colitis. Okay. Gluten should be strictly avoided for life, defined as one of that excludes white, rye, and barley. Even small amounts of gluten may be harmful, so these grains should be totally avoided for life in celiac patients. There is some debate about the safety of oats for celiac patients. The general consensus is that they are probably safe, but in practical terms, their inclusion in a GFD problematic because of potential contamination with gluten during processing. Serological testing may take some time to normalize, up to 1 year, but persistently abnormal serology beyond this stage should prompt concern over adherence to a gluten-free diet. Okay. A 37-year-old man is referred to a gastroenterology clinic because he is noted to have abnormal LFTs. Whilst the volunteering for a phase 1 drug study, further serology testing revealed that he is hepatitis C positive. Which of the following is respect to hepatitis C? So guys, here is genotype 5 has a response rate of 38 to 50% to antiviral therapy. So hope till here it's clear. Treatment of genotype 1, 4, 5 and 6 require 48 weeks. Pegylated interferon and ribavirin and leads sustained viral response rate is 38 to 50%. Treatment of genotype 2, 3 requires 24. So guys, I hope till here it's very much clear for you. If you have any queries, any question, you can ask me. If you're new on my channel, please subscribe it. Thank you. Good day. Goodbye. That's all for today.